Okay, we are back from the Watany Ophthalmology Summit, and it is our pleasure to have Professor Ludger Hanneken from Spain. He's a consultant of cataract and refractive surgery in Spain and Andorra. Good morning, Professor.
Good morning.
Tell us about the available dry eye therapies on the market right now.
Well, dry eye is going to be a very, very hot topic because ophthalmologists have seen that the dry eye problem is endemic and it has big relevances, especially when it comes to cataract and refractive surgery, whether it is corneal-based surgery or lens-based surgery. And we do have a lot of different treatment concepts in dry eye, and the devices which are recently available are growing. And what I'm going to present here is a combination of different treatments which I have named Andorra Dry Eye Formula, and the center of this treatment is a new device which is called Tixel.
Oh, interesting. So tell us more about the device and how it works.
The device is a new device which has been developed and used in aesthetic medicine because it's a thermofractional device where you can treat wrinkles, and as my clinic offers aesthetic procedures as well, I acquired this device. While doing periocular treatments, I've detected that I have such a positive effect on dry eye symptoms. I looked a little bit closer to that, I followed it up, and we could confirm that if you do it systematically 2 or 3 times every 2-3 weeks, that 80-85% of the patients, of the dry eye patients, have a remarkable improvement of their dry eye symptoms.
Okay, so we're looking for feedback from the patients, right?
Yeah.
What other parameters are you looking at?
It's a very good question because defining the parameters, whether you have a dry eye or whether you don't have a dry eye, is not easy. We have the questionnaires, the OSTI or the speed questionnaires. We have the osmolarity testing, then the NBUT, shimmer test, etc., etc. But basically, we don't have the one parameter which gives us the information if a patient is suffering from dry eye or not. And we monitor regularly with the treatment we offering right now, the OSTI and the NBUT, because these are parameters which I personally think are very important for checking the dry eye in a patient who is suffering from that.
Okay, and what is your experience with patients? Who are the patients who get the worst symptoms? Is it related to where they're living, the heat situation, the AC? What is your experience, and who would you say would benefit most from the device?
Andorra has a very dry climate, and starting to work in Andorra, I was confronted with many patients suffering from dry eye, so I had to do something. And I tried all the new technology, and climate, as I mentioned before, is a very substantial factor. But then, of course, all these office syndromes, the electronic devices which we use more and more nowadays, all this adds up to the problems of dry eyes. And from literature, and we know that the main reason for dry eye is evaporative dry eyes, so which is frequently, or it's based on MGD dysfunction, so we have to treat the MGD. But many of the dry eye patients, they are mixed patients. So we have noticed that also in patients which have low production, they profit remarkably from this kind of treatment as well.
That's very good, and we hope to see the device on the market soon. Any closing remarks you'd like to add?
What we're doing right now is we started multi-center international study because it's not only myself who has
Experience.
experience. It was confirmed now by a couple of colleagues. So we're starting the international study in Belgium. Participation was from colleagues from Belgium and from the UK and ourselves in Andorra. And I'm really interested to see how, with this ethic committee approved clinical proper study, is going to finalize, and then we can start publications about this treatment. And I think it's a very promising and interesting new technology.
You sound very enthusiastic, and I hope we can hear back in Cairo from the results of the studies.
Okay, you're welcome.
Thank you very much for your time.
Thank you. Bye-bye.